Have you ever wondered if your flexibility and or mobility sucks? Hint, it probably doesn't. And if it did, you'd probably know about it. But we're going to dive into those topics and hopefully give you some practical recommendations of how you can get more mobile for your sport or life. So the first aspect of flexibility, mobility, and or warming up is going to be what's known as the ramp protocol. This is an acronym, and the R specifically stands for raising your body temperature. This is particularly valuable because it makes your muscle tissues a little bit more elastic and you're actually able to increase your flexibility in this instance. So that's why you see a lot of people doing cardio before they were to lift, but we'll get into that a little bit later. Next is going to be activate and mobilize the target muscle. Think about the first time you put a barbell on your back and you try to squat down to the bottom. Your knees crack everywhere. You're like super tight, probably grown if you're over 30. Um, that is an instance where we're trying to mobilize the target muscle and kind of activate it a little bit, get blood flow to the area so that hopefully you don't have pain in the bottom of that position and you're going to be race ready to go to actually lift that weight. And the P in ramp is going to stand for potentiate, which just means we're getting our nervous system essentially ready to lift that load. And again, we'll have practical recommendations at the end of this video for actually how to implement this. So there are a few key factors that actually affect your ability to be mobile or flexible. The first is going to be joint structure. So the way joints actually sit, your hip, for example, into the hip area actually predetermines how mobile you can be in any instance, like physically bone on bone, it won't let you move anymore. That's just out of your control. You should have picked better parents, basically, is what you have to deal with there. Next is going to be age and sex. You can only be so flexible as a 95-year-old man comparatively to a 15-year-old female gymnast. So there's just certain things that kind of stack the cards either for you or against you. Next is going to be the actual elasticity of your muscles and connective tissues, how stretchy essentially a muscle is. And this is one of the things that the ramp protocol hopefully helps you increase temporarily. Some other factors that affect your ability to be flexible and or mobile is going to be pain, like ouch, it hurts. You're going to stop stretching in that position, right? And the next is going to be the stretch reflex. Oftentimes when your limbs get put into certain positions, your body actually will activate that muscle to contract so that you don't end up hurting yourself essentially. And that can be a factor affecting your mobility. You can kind of think of when you're sitting at the doctor's office and they hit your knee with a hammer. That's an example of the stretch reflex. All right, now we got a little bit of the bonus round $1,000,000 key terminology here. The first one is going to be flexibility, and the second one is going to be mobility. Flexibility is essentially your body's ability to move through a range of motion. So right now I'm exhibiting flexibility as I move my arm all the way around my body, etc. What mobility means is it's your ability to be strong and or athletic in those positions. So if I can get my arm all the way up here, but I can't support any weight or be athletic in that position, I'm not necessarily mobile or have the mobility for my goals in that area. So I can get it up here, we're plenty flexible, but we might not be mobile. And mobile is oftentimes the thing we care about when it comes to athletes. So we talked about warming up, we've talked about mobility, flexibility, etc. Now we can kind of talk about the benefits of stretching, get into how you should do it, and maybe some practical recommendations for you there at the end. Some of the benefits of stretching are going to be a temporary increase in flexibility. Oftentimes this goes away by the time you've driven home and gotten in your car. If you want long-term benefits in flexibility, you need to do stretching of multiple types, multiple times throughout the week with a large degree of volume. So you need to kind of think of it like another form of training. Next is going to be when you should actually stretch. The first and most obvious answer is you should consider stretching if you have a flexibility deficit, so you're not able to reach the positions that you need to reach. As far as when you actually schedule this stretching, it should likely occur after a workout or on a completely different session. This is because it's not going to get in the way of your performance on other things. And in terms of after a workout, your muscles are already going to be warm and pliable. There are three main types of stretches that we can look into that are at least mildly useful. The first is going to be static stretching, which is the one we all did in youth soccer, where you hold a position to where it's slightly uncomfortable and you hold it for 30 seconds to a minute. This is a perfectly fine style of stretching, and it's one of the three main ones that you can use. Next is going to be dynamic stretching. Dynamic stretching is where you see athletes kind of going down the field, going through various positions. It's essentially a form of graduated movement going through large ranges of motion that's going to elevate the body temperature, get blood flow to the area, and kind of potentiate your ability to be athletic specific to those movements. The last is going to be proprioceptive neuromuscular facilitation, or PNF for short. This is essentially where you have a partner put you into a deep stretch in a specific position, and you're going to contract that muscle to fight against them. After you've contracted that muscle and fight against your partner for a long enough period of time, you will then relax your muscles and your partner will put you into an even deeper stretch and you progress as so. It's very painful, but it is very, very good at increasing flexibility. Now it's time to get a little bit contentious. We're going to talk about the return on investment for actually spending time doing flexibility or mobility training. You do not have a specific flexibility deficit and you cannot get into specific positions relative to sport or life. Don't stretch. There's no reason to stretch. If you can hit all the positions you need to, you can go through your life, you can go through your sport, and you're flexible and mobile, absolutely zero reason to stretch. None. You can leave the video, see yourself out, and go be perfectly happy in your life. If you have a flexibility and or a mobility deficit, the next thing you should consider doing is starting with stretching, specifically if you have a flexibility deficit, and then progressing into full range of motion lifting. Full range of motion lifting is one of the best bang for your buck ways to get flexible and mobile if you have deficits. Gradually progressing your lifts deeper and deeper and deeper till you get to those big full ranges of motion is a form of PNF style stretching. You're literally using the bar as a partner essentially to push you deeper and deeper into that stretch position that you're then fighting against. So it's one of the best types of stretching that you can do from a mobility standpoint, but is also very, very time effective. And one of the reasons that lifting specifically is so valuable is because it increases that flexibility, that overall range of motion, but also increases strength in those positions, which is what is actually valuable on the sport and in life. Well, the take-home message there is that flexibility without mobility is largely useless. No one cares if you can get your arm to here or here or here when you have someone trying to tackle you on the field. It matters if you can be strong in these positions, and that's mobility. Bonus point, if you want a general, really good quick test to see how flexible and mobile you are, look at someone's overhead squat and you can kind of see all the areas where they might be deficient in. And there's many resources online that you can look at. If their knees cave in, if they tilt forward, it'll tell you exactly the areas where they're either tight or lacking in mobility there, and you can go from there. But overall, most people don't have deficits that are so severe, especially athletes, that you need to do large scale, crazy changes to their programming. Just watch how they move, consider implementing a little stretching if there is a deficit, and gradually increase to full range of motion. That's going to be the best bang for your buck way to get flexible and mobile with very, very little time spent. If you're spending 15, 20, 30 minutes stretching and you don't have a specific deficit, I can confidently say you are wasting your time and that would be better spent lifting.